Welcome this week to PSN at Home. This is TJ Kennedy, and I'm here with Jason Karp, as well as Chief Gary Ludwig. Chief Ludwig has spent his 40-year career as a firefighter and a paramedic, and has led a number of key departments from St. Louis to where he is now at Champaign, Illinois. He is also the president and chairman of the International Association of Fire Chiefs. And welcome here today, Chief Ludwig. We appreciate you joining the show.
It's an honor to be here.
One of the things that I think is just so important with what's going on around the country with coronavirus is we keep laser focused on what our first responders are doing each and every day and putting themselves in harm's way to take care of our citizens. And I know most people are very appreciative of what's happening, but I don't think they understand the strains that are on fire departments, the strains that are on EMS agencies. And they don't understand that when we talk about the need for personal protective equipment, or we talk about the need for funding to make sure we're meeting the needs of our responders, what that really means to them and what it means to their community. And as a fire chief who's on the front lines with this every day across the country and a leader in the fire service for the United States, we would just like to get your opinion on what's happening today, what's working well, what's not working well.
God, there's a lot to talk about there, but I'll just share with you that we at the IFC and myself as president and chairman of the board have been fighting for our firefighters out there and our paramedics. We got reports early on of lack of PPE out there. We got reports. I talked personally to fire chiefs who were using raincoats to protect their people, buying ponchos, things that were just unacceptable when it comes to protecting our people. Talked to one firefighter paramedic in Memphis who I worked with while I was there as a deputy chief for 10 years. And he told me that they're using the same N95 mask for three straight shifts, which is 72 hours. These are all unacceptable conditions. And so we have fought vehemently, we've fought aggressively to get PPE to our people. And so it's nothing more important at this point. So we as fire departments have been hit operationally and economically for what I call the warriors at the tip of the spear. They're the ones that are out there on the front lines. And I speak to the Senate and House Appropriations Committees as I have. I spoke with the FEMA administrator, Pete Gaynor, for about an hour a couple of weeks ago about these issues. The National Governors Association, I tell them that when you see the TV and all the wonderful work that's going on by nurses and doctors and the ERs and up on the floors, how do you think those patients got there? They got there through the fire service. We're the largest providers of EMS in the United States. And so it's our warriors at the tip of the spear that are out there that are doing all the yeoman work that we see to take those patients and care for them and treat them and transport them to the hospitals. And so it's so important and so imperative. I got the numbers yesterday, and it is shocking, the numbers I'm about to give you. But as of yesterday, we've had 46 people in our profession, fire and EMS, die that have contracted coronavirus. 46, that is unbelievable. And that's a total of 26 firefighters, somebody in fire, and then 20 EMS only personnel. That's unconscionable. We should be doing better to protect our people. But it's not the department's fault. It's not their fault that contracted it. We've had over 1,000 firefighters that have contracted and been diagnosed with the coronavirus. It's not their fault. They're out there doing what they can, but it's important that we get them the PPE. And I can delve into some of those reasons why, but it's clearly evident that FEMA and a lot of these states do not consider us the priority when it comes to distribution of PPE. And that equipment is coming out of the National Strategic Stockpile. National Stockpile is going to other places. I had a fire chief tell me in Florida that the health department in Florida has directly told him and other fire chiefs on the phone that firefighters are not the priority. It is the healthcare workers, which is unconscionable. This fire chief, out of 2.9 million N95s that have been delivered to Florida by this point, out of a 16-station department, he has a good-sized department, only received 40. That's 40 N95s out of 2.9 million. So we continue to see the fights. I got to send an article from Loudoun County, Virginia today. One of the former fire chiefs sent me an article from there where the government went in. They actually went off market and went off the grid, so to speak, and because they weren't getting what they needed from the Strategic National Stockpile and bought directly from manufacturers, and it was seized by the federal government. So TJ, these are the things that we're dealing with out there, and then the economic downfall is coming with these governments, municipal governments that have lost tax revenue. So now the slap in the face will be the layoffs that are coming. It's been the volunteer fire departments that have been unable to fundraise, and then they're still trying to maintain their operations. And I've talked to one fire chief who has 196 firefighters, and he's already been told to start preparing for 35 of those firefighters to be laid off. I've talked to other fire chiefs, and I'm kind of going on here, so just allow me to talk if you don't mind.
No,
but they've been told to prepare for 5, 10, 15, and even 20% reductions in their frontline firefighters. A friend of mine who was a fire chief outside Chicago, he's already been furloughed 1 day. And I thought, 1 day's not bad. And then I started doing the math about 10 seconds later. Well, that's a 20% pay cut for him.
right.
Again, I can go on and on with the stories, but we are getting hit operationally, economically. We've been asked to step up and respond. Now, one of my fights has been to ask Congress to step up and help our fire departments out there to maintain the operations that we should be having.
Well, there's no more important issue today, I think, in our country than this issue. And I think I'm biased. I grew up a firefighter. I started in a volunteer department. I went on to a career department. You mentioned something that I think most people in America who don't live in a big city actually do understand, is the fact that their fire departments are supported by literally pancake breakfast. They're supported by bingo. They're supported by things that go on in their community to help fund what they do. And none of those things are happening right now, but they're still responding. And they're still responding with not necessarily the right protective equipment, or they're buying it on the black market because they need to have it. And that has to be there. And for the career departments, like you mentioned, that are just, they're getting that across the board. Hey, we need to cut public works. We need to cut health and human services. We need to cut the fire department because we're not having that sales tax revenue. It can't happen. When folks call 911 in the US, or they call their emergency number in other places around the world, they have to know that fire and EMS and law enforcement are going to show up and meet their needs. And we have to do that. And we, as leaders in public safety, have to support our firefighters to be safe in what they're doing and give them that equipment if we can get our hands on it in any way possible. Jason actually lives in Loudoun County, where you were just mentioning. So I don't know, Jason, if you have any thoughts on that.
Yeah, no, absolutely. I mean, as you were saying that, and I actually interact with the local Loudoun Fire and Rescue quite a bit around here, both the current folks and some of the former. And I know they're going through tremendous challenges here. I mean, the good news is, at least in Loudoun County, we haven't had quite the same numbers as in some other areas in Virginia. We have had sufficient beds, that kind of thing. But, first responders are dealing with this everywhere. I'm seeing it firsthand, and it's really a difficult situation. In fact, one of the questions I have for you, I think, which, our listeners hopefully find really useful, is, I know you're advocating at the national level and you're doing so much to help solve this problem. Are there things that the local agencies, local firefighters can be doing to help improve the situation, in standardized procedures with disinfection, of PPE, how they can get their hands on other PPE, advocacy work? I know, for example, there's, Cuomo just announced like a 7-state consortium, buying consortium, New York, New Jersey, Connecticut, and up in the Northeast, to get that buying power so that, that they can compete in trying to get PPE, both in terms of it going internationally and from the federal government. So what are some of the things that, folks can do on the ground to help the situation?
Well, there's a couple of things. One, actually, Loudoun County was also in the consortium also. They weren't buying individually, they were in a consortium. I know in my particular county, which is Champaign County, about 2 hours south of Chicago, we're banding together as a county, again, in a consortium to buy stuff directly from manufacturers, while we're also trying to get stuff through the National Strategic Stockpile through our state emergency management agency. So, but one of the things that the firefighter and the paramedic on the street can do is help me deliver the message to Congress. The IFC has a legislative action center set up. It's real simple. You just go to, I'll give you the URL. It is iafc.org/take action. Again, that's iafc.org/take action. And you just click on that, and there's a box there that says support funding for local fire and EMS departments. And you click on that, and it actually fills out a letter for you, All you have to do is enter your name and I think your email, your zip code. And why your zip code is so important is it'll pull up and send it to your U.S. representative and your 2 state senators and also the White House. This message that we need funding. We're asking for $5 billion in funding for AFG and $5 billion in the SAFER grant program, which is the staffing for adequate fire emergency response. You know, I've talked to at least 6 different Senate and House Appropriations committees. I spoke with Chuck Schumer's office. I spoke with Nancy Pelosi's office. The list of people spoke with the White House, spoke with undersecretaries at the Department of Homeland Security about all this. And some of them have brought up, well, we're gonna go for another stimulus bill, but we're gonna put one big pot of money for governments. And I say, no, we don't. That's nice that you're doing that, but these AFG and SAFER grants are specifically set up, then they're very transparent. It's a peer review process. It goes directly from the federal government into the coffers of the fire departments. And many volunteer fire departments, fire districts, do not work for municipalities. So they're not going to get any of that funding that's in a general pot of money for state and local governments. So I need the people that are watching this webinar to actually get on that website and send a message to Congress supporting $5 billion for AFG and SAFER. And we think that is a small portion of what we need based upon our economic study impact of what we've been doing. And so that's what the ground firefighter on the ground at the tip of the spear can do to help us help them.
No,
I just have to say to that point too, I've done it. I've gone on and taken action myself and filled it out. It takes less than a minute or 2 to do it. It also gives you a place to personalize it to your own experience, which I recommend every firefighter and paramedic out there take the moment to do that. And it's just critical to speak up now, because there will only be limited chances for this to happen. And the Assistance for Firefighter grants, the AFG and the SAFER grants, as you said, these are the lifeblood of our fire department's funding from the federal government. And there could not be a better time to add funding to them now with what's going on and the level of support that all citizens have received from their own fire department and their own EMS agencies. And a lot don't understand that there are fire districts that cover multiple municipal and county jurisdictions, or that there are EMS agencies that are private and public and different things. But at the end of the day, we need to get this money directly into our fire departments to support what's happening. And we encourage everybody who's listening today to go out there and do that. And even if you just support your fire departments, please contact your representatives as well and leverage the IAFC Take Action website to be able to do that.
absolutely.
Yeah, it doesn't have to be just the firefighter on the ground is wonderful, but tell your mom, tell your dad, tell your sister, your cousin, whoever. That website is open to anybody to send a message. And we have sent thousands of letters so far. And I'll just share with you, we have a 3-pronged approach going with the IFC. The International Association of Fire Chiefs has taken the lead on this, and we've been talking obviously to the decision makers, as I just listed some of them, in Congress and in the White House, and also part of the administration. We have a media campaign going, or you're right, you see me on Fox, you heard me maybe on ABC Radio News, Huffington Post, Congressional Court. I mean, the list of stuff goes on and on. I got some conversations going on with EMS. I'm not EMS today. The Today Show, maybe we might be on there soon. So that's the second leg of this. The third part of this trifecta, what we're trying to do is my call to arms or my call to action, where we need the average firefighter. I don't want to say average. I'm talking about, because they are above average in my mind, but the person on the street, the firefighter who's at the tip of the spear, to send those letters to Congress. And we know that each senator is not going to read each letter, but the staffers get them. And when the staffers sit down with them and say, we just got 50, 100, 150, 200 letters in from firefighters, they listen to that. Mm-hmm. And so these are people from their district, from their state. They listen to that. They're not reading those individual letters, but those staffers are receiving those letters.
Now, I spent a lot of time on Capitol Hill in my days in Washington, and I can tell you that the preponderance of all those letters coming in and from their own constituents who vote for them, it is very important. And we need to speak with our pen, and we need to speak with our voices to make sure that everyone is heard and that the fire departments get the funding you deserve.
Roger that.
Absolutely. It sends such an important message. I know I've done it. My family's done it. TJ and I, obviously, when we were with the federal government, we spent a decent amount of time on the Hill with these folks, and it does make a difference. When they start hearing from firefighters and specific groups within public safety, they will take action, but they need to hear from people, and I think that's critical. And I think your message is so important. So appreciate that you're sharing that with everybody today.
Not a problem, and it does, as you guys know, it works. You're not wasting time. TJ, you said it only takes less than a minute, and it does. It fills out the form for you, and all you do is hit the submit button.
Yeah.
Nope, I think it's great. And I think let's just close this here on this message. This is so important that everyone out there, everyone who supports the first responders in your community, fire, EMS, and law enforcement, we have to speak up now, and we need to make sure that our firefighters and our paramedics and other EMS personnel have the PPE that they need, they have the funding that they need, and we need this both now, but also after this initial wave is over and before the next wave hits and all the other things that are going to come into this, as well as continuing to provide the 24/7 fire and EMS services that our agencies always have provided. And it cannot be at a reduced level. It has to be probably at a higher level than what we've had, because it's just a different experience right now and really needs to be done.
Roger that.
Yeah, and TJ, you said it. It's a long-term solution. While we have a short-term issue that we need to resolve, Chief, as you noted, there's going to be the financial repercussions of all of this, and this funding is just going to be critically important to continue to fund, critical programs, within the fire service. They're just so important to all of us. So, people need to think about this long term. It's not just a now problem. It's a long-term, several-year problem that we all need to be part of the solution.
Roger that. That's absolutely correct. And, as I've been telling a lot of these decision makers, we're not asking for more firefighters. We're just asking to maintain the existing frontline workforce that we have out there that responds to emergencies every day. I tell them there is no 912 on the phone dial. That when you dial 911, there's nobody else to call after us. So if we don't show up, there is no 912. There's nobody else to call. That's why it's so important. If we were in the middle of a war, Afghanistan or Iraq, you never saw them trying to cut the military during the middle of a war. So why would we want to cut firefighter positions? Because the next war that we may have to fight, if this virus mutates and we had to see a second wave in the fall of the year or next year, is actually what happened in 1918, with the great influenza. We're going to need this existing workforce. We're going to need these firefighters out there. These volunteer fire departments need to be funded. Even SAFER helps volunteer fire departments with recruitment and retention programs. Mm-hmm. So all these programs are direly needed.
No, we agree. We really appreciate you taking some time out of your important schedule. We know how busy you are across the country trying to help departments get what they need to be successful and leading your own department at the same time. So thank you for taking time to meet with us today, and we'll get the word out.
Sure.
Absolutely. Thanks, Chief.
Thanks, Chief.